Alright guys, welcome back to my channel, and here we are with another video, and we will be discussing, this will be the last part of the permanent maxillary canine. So let's begin. First, the root. What do we see in the root? So first we see there's only one root. Okay, unlike the premolars, molars which have 2-3 roots, the canines have only one root. The size of the root is the longest. So as we had discussed that the permanent maxillary canine, they have the longest root in the dental arch. The root shows lingual convergence. Okay, they have lingual convergence from the proximal sides coming up. Now DDs. What is a DD? The developmental depressions. What is a developmental depression? So they are present, so they are grooves. Okay, so developmental depressions, basically they're present in the root, and the distal sides developmental depression is deeper than the mesial sides. Okay, here also we are seeing in the identification feature that it's the same only, that the distal sides developmental depression is deeper than the mesials. Now let's see the identification features. So as you know that the crown is long and the root is the longest. These are some identification. If you get a canine, you can easily identify. Also that canines have very well developed cingulum. Okay, now side identification. When you see from the distal and the mesial aspect, what can you see? So when you see from the side, the distal cusp slope, alright, the distal cusp slope, I've drawn the diagram also for you so that you can understand what is the difference and where are these. Alright, so distal cusp slope is this one. So this one is, it is longer than the mesial cusp slope, and the mesial marginal ridges, it is longer than the distal. The mesial marginal ridge, you can see it is from here to here, and this one is only here. Okay, it is shorter. So mesial marginal ridge is longer than the distal marginal ridge, and the distal cusp slope over here, it is longer than the mesial cusp slope. I hope this difference is clear. What is the cusp slope and what is the marginal ridge? Marginal ridge is over here, it is above from the contact point. Okay, contact area, right. Then few more points, that the root apex shows a distal curvature. That is, when you draw the root over here, alright, supposing the root is a distal curvature. Okay, if this is the labial side, then distal will be here. So it is a bit labial, distal deviation like this. Wait, let me show you. Right, there is a bit distal curvature. It is a small bend, and then the crown. Okay, they have got DDs, and there is a distal curvature curve on the distal side for the root. And the last point is nothing but the same point, the developmental depressions. So what did I say? The developmental depression on the distal side is deeper than the mesial side. Alright guys, we finished with this canines, that is the maxillary canines. We will discuss about the permanent mandibular canines in the upcoming video. Alright guys, thanks for watching. Do like the video.